Good afternoon, everyone, and welcome to the Multicultural Media Online Conference today with Minister for Multiculturalism, Natalie Ward, and Senior Medical Advisor, Dr. Jan Fizzell. Thank you very much for joining us today. We would like to inform you that Minister for Health, Brad Hazzard, and Chief Health Officer, Dr. Kerry Chant, has sent their apologies as they are unable to join us today. I'm Jasusa Halaratna, Deputy Director of the Multicultural Health Communication Service. On behalf of New South Wales Health and Multicultural New South Wales, welcome to the forum today. For us here in New South Wales Health Office, we'd like to begin by acknowledging the traditional owners of the land on which we're meeting today. Here at St. Leonard's, we'd like to acknowledge the traditional custodians, the Kame-Regal people of the Guringai Nation of the Eora Nation. We pay our respects to elders past and present and emerging, and also for Aboriginal colleagues. We would also like to acknowledge the elders of those multicultural communities represented for those attending today. We'd like now to pass on the forum to Minister Ward and then to Dr. Jan. Minister Ward. We have some technical problems. We'll get back to Minister Ward. Dr. Jan, how are you today?
I'm well, thank you, Jess. How are you?
I'm good, thanks.
It's been a busy weekend and week for all of us, and I think people are understanding that the restrictions are going to be in place for a while longer. We're still seeing spread of cases and with a number of people infectious in the community on each day. Those LGA restrictions have extended because we're starting to see further spread outside of the 3 original LGAs. And so it'll be really important for people to keep up to date at the nsw.gov.au website with all the latest information for each of those LGAs.
Yes, and we have today recorded 172 locally acquired cases of COVID-19 from last night, and at least 46 cases. Is that correct?
That's right. So that's why it's so important that people, no matter how mild the symptoms, and for the Delta strain, it can be just a very mild runny nose. It can be a headache. It can be a sore throat. It can be a cough. It can be, for younger people, it can just be a headache and feeling really run down. Those are all good reasons to go and get a COVID test. And by keeping people with symptoms getting tested, it's given us some of the best ways of getting control.
Thank you, Dr. Jan. And also probably a lot of people are wondering if why we're not wearing masks, but we have our masks here today.
We do. And we know that for a lot of people who are hard of hearing, that seeing our lips is really important for getting those messages. And that's why we don't have the masks on in the studio. As soon as we finish doing this, the masks go back on. We've got our hand cleaner to clean our hands before the masks go on, but we do just need to be careful of each other. And that's why we're not wearing masks at the moment.
Yes, and to let everyone know, everyone here in this room are all wearing masks. So I guess, Minister Ward, are you able to join us now? You have your audio. Nice to see you. Nice to hear you.
Technical issues. Thank you, everybody, for bearing with me. It's we've been going from WebEx to Zoom and back again, so forgive me. But thank you, everybody, for attending today's very important forum. I'd just like to emphasise once again that you are absolutely crucial partners in this. And once again, it's very important that we get together and we recognise that you have such a critical role in promoting our public health messages. The New South Wales Government recognises that, and I'd like to personally thank each and every one of you for conveying those critical messages, including particularly the stay at home message. It's really important. In the past week, we've opened applications for the Multicultural Media Grants Program. I encourage you to apply if you haven't already. That is through Multicultural New South Wales. I'm sure that we can put that information up there, but I encourage you to please go ahead and apply for that. We want to hear your ideas about how we can expand our messaging into our communities. It's so important, as I've said before, and I'll say it every single day until this is over. We're really excited to also have launched the Australia First pilot program, delivering live interpreting of our daily New South Wales COVID-19 press conference. And that's just a very exciting initiative that has come out of this. Some good things have come out of this situation that we're all in, and that live translation of the daily press conference is one of them. Arabic and Vietnamese interpreters are now interpreting this in real time. And we also aim to add additional languages, and we'll have more about that to say in the future. But we've also recently, the New South Wales government's delivered a $6 million funding package, which I was delighted personally to be able to deliver for asylum seekers who need emergency support during this pandemic. It's really important to keep this group supported. We know that asylum seekers and temporary visa holders are so critical, and so I'm very excited to have announced that $6 million package there, and I'd like to thank Multicultural New South Wales again and the critical role that they have in implementing that, and particularly the NGOs. The money will go through those NGOs who have direct links to those most in need, and I just want to thank them and have a shout out to all of you working so hard in the NGO space. We really appreciate it. Look, we know, again, this is a very tough time for everyone, particularly with the announcement this morning of the extension to lockdowns. And we recognise that, of course, that wouldn't have been done unless it was absolutely necessary and on the basis of health advice. So I just want to extend my gratitude to each of you for bearing with that and working, as you have so beautifully, working with us and partnering with us to walk by our side in this journey. Please know there's financial help available, and the joint New South Wales Government and Commonwealth JobSaver program is being significantly boosted to help those who are impacted. So I might leave it there so we have time for questions. I just want to thank you all again sincerely for all you're doing to get the message out to every corner of our community in language and through your wonderful channels. Thank you. I'll perhaps hand to Dr. Jan.
Thank you, Minister Ward, for that. I just wanted to remind everyone to please, since we have only 30 minutes, to please keep your microphones on mute and please put your questions onto the chat. So we'd like to also start, and also if you want to know about the grants, CEO of Multicultural New South Wales, Joseph Laposta, has already put that link online so you can get into that. So we'll start with the questions. The first one, Minister Ward, is from Suzanne Horani from Radio Tomorrow. And whilst the world is trying to deal with COVID-19, there has been growing concerns about the delay in vaccination rollout. People in our community don't want to get the AstraZeneca jab. They have their own concerns. We don't have enough of the Pfizer vaccine. Do you believe that we have a problem in proper messaging? How can we convince people to get a vaccine they're scared of? Is Pfizer vaccine safe to be used for 16 to 18 years old? Minister Ward, would you like to start?
Thank you. That's an excellent question. And I just want to take this opportunity to echo the message we hear every day from our Premier and our health officials. Get vaccinated as soon as possible. Please access the vaccination. There can be no greater endorsement of AstraZeneca than to hear from our Chief Medical Officer, Dr. Kerry Chant, that she herself has been vaccinated with AstraZeneca and that her loved ones, those most important to her and her family, have as well. That is the greatest endorsement we have. I have been vaccinated and many of my loved ones have too. So we just can't state it enough. It is absolutely critical to get the message out. Get vaccinated and get vaccinated now. Don't delay, as soon as you possibly can. We have plenty of AstraZeneca. There's plenty of that to go around. And I know that I'm not the health expert, but I do know how to roll up my sleeve and get the jab. So please convey to everyone you know, get the jab, get the vaccination. That is our pathway out. But I might defer to the health expert, Dr. Jan, for your answer on that.
Look, I think we've been really lucky here in Australia where we haven't had to actually live in fear of COVID for a very, very long time. But what we are seeing young people, old people, people in between. They are being hospitalised with COVID-19. They are in ICU with COVID-19. And sadly, we've had deaths of both a person in their 30s right through to older people. When you have an epidemic of COVID, such as we have in Greater Sydney, the small risk of a side effect from a vaccine compared to the very definite risk of COVID-19 infection. And even in young people, they are having that long COVID syndrome where they may even have a mild illness, but then have weeks and months of feeling under the weather and fatigued and not being able to think properly. While ever we've got that going on, we can help protect people from that long COVID. We can help protect people from hospitalisation. And so the risk of a small risk with the AstraZeneca vaccine compared to the very real risk of COVID, which can do all of those same things. COVID itself causes clots, it causes unusual clots, and people can die from clots caused by COVID. So it's really important that people understand that COVID is a very serious disease. It is causing major impacts on people here in Australia and particularly here in Greater Sydney. So if you are offered the vaccine, if you are over 18, the best vaccine to get is the first one you can get in your arm.
Look, I am vaccinated with AstraZeneca and I feel fine, and I'm really glad that I did for 2 jabs. So Dr. Jan, thank you for that, and Minister Ward. Can you explain what the symptoms are of Delta strain so that people can understand what it is, what it does?
Yeah. So it basically can be just a runny nose and just feeling off. It can be a sore throat. One of the interesting things is in the UK, they're reporting fewer people with the change in taste and smell that we noticed with it. But the key thing is you don't need all the symptoms. Any one symptom, you should go and get tested. So even if you've got a bit of a runny nose, if you go, oh, it's because it's cold this morning, if it's not better when it would normally be better, you should be getting tested. If you've got a bit of a headache and feeling run down, don't wait and see if it gets better, get tested, because the problem with Delta is you can give it to other people before you actually know you have it yourself. So by the time you're getting symptoms, you've already been able to infect people for 2 days. And so it's really important that as soon as you get that very first part of a symptom, you need to go and get tested because it is so infectious.
Thank you, Dr. Jan. And so remember that you can go to newsouthwales.gov.au for all the clinic information. Now, another question here from David from Yale. Our neighbour Victoria has just lifted lockdown restrictions, and they already have further plans in place for another phase of restriction removal. I've noticed that New South Wales has also removed the stay-at-home order in 3 regional areas. Are there any plans to ease restrictions in metropolitan Sydney? Minister Ward?
Thank you so much. Yes, we are continuing to constantly assess what will happen in Greater Sydney. And as you would have heard this morning, given the current situation, the lockdown will be extended for a further 4 weeks. We're following the health advice. As a government, we make this decision based on the evidence and based on the health advice that we get from the experts to make these decisions. We need to keep Sydney in lockdown for the moment so that we can get on top of this outbreak. That is our aim. The Delta strain, as we hear Dr. Jan and Dr. Kerry Chant saying every day, the Delta strain is especially contagious. People must stay at home. Please do not leave home unless you absolutely have to.
Thank you, Minister Ward. There's a question here from Pawan Lutra for Indian Link. Following on from the Premier's announcement this morning that 40,000 Pfizer vaccines are available for Year 12 students in selected LGAs, where do they get access to these vaccines? Are there any special hubs being set up in their schools or through their GPs?
So my understanding is that the schools will be communicating with their Year 12 students, and the arrangements will be made with those schools and with the students themselves. So Year 12 students looking out for a message from school, and that's where you'll hear the information about where to get vaccinated.
Thank you, Dr. Jan. That's great. So please check out the schools and advice. Minister Ward, another question here. In my area of Canterbury, Bankstown, there are many refugees and boat people. They have no jobs and not supported by Medicare or Centrelink. What can our government do for them? And who do we need to contact for immediate support? This is from Abdullah.
Thank you so much. An excellent question. We recognise that this pandemic has been extremely tough on so many people, including asylum seekers who could be, as we know, at risk of homelessness or being destitute. That's why the New South Wales government has allocated $6 million to help them to get essentials like food and medical care, including healthcare, mental health care, and to help them meet rental payments. We are here to absolutely support all of our community. And that money will be distributed through Multicultural New South Wales to non-government organisations who have direct access to the asylum seekers who need this support. We've heard that, we know it, and we've acted really quickly to make sure we're getting that out on the ground so that those NGOs who know exactly where and have direct access to those asylum seekers can get that support out to them. Those examples of the specialist NGOs who support those asylum seekers include the Red Cross, Settlement Services International and the Asylum Seeker Centre, and I just want to call those out for the great work that they do. But anyone that needs emergency support now can contact one of those organisations directly to discuss their circumstances.
Thank you, Minister Ward. Dr. Jan, there's a question here. Is Pfizer safe for kids aged 16 to 8? This is from Suzanne Harani again.
Yes, it is. It's been approved by the Therapeutic Goods Administration for actually now children 12 and over, but the supply we have at the moment is for people aged 16 and over. So that would cover our Year 12 students.
Thank you, Dr. Jan. Minister Ward, another question here. This is from Fred Zhang from Sydney Today. The anti-lockdown protest happened last weekend is certainly making most people disappointed. It adds lots of pressure in our efforts of countering the pandemic. Now we know the lockdown will be extended for another 4 weeks. What's the government's plan of preventing similar things from happening again? I think we'll ask Minister Ward to answer, and from the health perspective, Dr. Jan.
Thank you. Yeah, look, I just want to echo exactly what the Premier said. What we saw was heartbreaking and frankly, it was disgusting. That was just appalling behaviour. The police have made it clear they will not tolerate a repeat of the violence from last weekend. We just won't. It's just not fair to everybody. There were more than 10,000 calls to Crime Stoppers about people who attended the protest, which is proof that the community absolutely rejects the actions of those selfish people. So we will make sure that we do everything we can to keep everyone safe, which includes clamping down on that. But I'll hand to Dr. Jan about the plan for the health perspective.
Look, the key thing for us is anytime more than one person is with another person, the risk of spread is so high. And it's incredibly disappointing when we've got all these people who are giving up so much for so long to have people try and undo that good work. So I can't say it strongly enough that the reason why we're asking people to stay at home is to save people's lives, and not just from COVID-19. We also need to keep the health system operating so that people who have a bad accident, so that people who have cancer, so that all of those people can continue to be treated and looked after in our healthcare system. And when we get a COVID wave like we have at the moment, where we have one of our tertiary hospitals, the equivalent of one of our big hospitals would have their whole entire intensive care unit full at the moment if we put all the COVID cases in one place. That's a whole lot of beds that aren't available for a whole lot of other people who may need them in the future. So we really do need people to understand that even if the risk to themselves may not be that great because they're young and fit and healthy, but even young, fit and healthy people have wound up in ICU recently, the risk to the community is just extraordinary. And it's just so sad because if they take it home, they can, kill their family, and no one wants that.
And that's why we're reminding people not to visit anyone and not to receive visitors.
And that's right. So many people are doing the right thing. They're staying at home. They're nominating one person to be the person who cares for their vulnerable family member. They're doing the contactless drop-off of food and supplies to that person who might not be able to go shopping, but they're not going through that front door. They're actually, staying back, having those conversations over the phone at a distance, and are giving up on that physical affection and are giving up on that, that time with someone that you care about to do this. I haven't seen my mum in many weeks. I know many people in your communities have not seen your family for months and now over a year or two. So with all the sacrifices all the rest of us are making, to see that sort of selfishness and that self-centeredness is just, I have no words.
Yeah. I agree, Dr. Jan. I think it's important for those people, just reminder to get tested, and that's the most important thing, and remember to follow the stay-at-home order.
Absolutely. So if you've gone out and if you have exposed yourself, if you've got any symptoms, get tested and stay at home. And if you're in the same household as somebody who's gone out, just, try and separate yourself from them as much as possible. I know it's really quite hard in many people's living situations, but and also just as their friends and family, just tell them what a doofus you reckon they are, because I can't say, I could say something more strong, but I think I'm not allowed to.
Minister Ward, there's another question here by Sonam. The pandemic has brought to the fore the critical role diverse community media plays in connecting with our multicultural society. Do you think perhaps now it's time to sell the relevance of multicultural media to our businesses and government bodies?
That's a fantastic question. I'm always a huge supporter of our multicultural media, And we've seen it's come into its own uniquely in this pandemic. It's just so critical. And we know that with the multicultural media grants, that the applications have just been flowing in. We want to get that support out to them and get the $2 million to be shared and the additional 2 million that we've already put in on top of that. So yeah, absolutely. We're really keen to, I think, demonstrate that we've had to rely on our multicultural media to really get the message out to every community in language in each of the forums that it has been. And it's very exciting that we have had this opportunity to work so closely together. I will always, as Minister for Multiculturalism, be a huge advocate for our multicultural media and support it in every channel. But I think this has demonstrated it, that it's been absolutely critical in getting our health messages out there.
Minister Ward, there's a follow-up question here since you mentioned about the live streaming of translations. The Chinese daily Chinese Herald, this week you launched a translation. Is there any plans of doing this for Chinese community, and what platform will you be using, as majority Chinese don't use Facebook?
Absolutely, yeah. So it's been fantastic. I'm so excited that we've had the opportunity to come up with the live translations. It's been just magnificent to be able to reach so many members of our community through those translations. The Arabic and Vietnamese has been streamed through the Arabic and Vietnamese Facebook pages and also through radio. But absolutely, I know that we will, very exciting that we are translating into Mandarin. I think that goes live tomorrow. I don't know if I'm supposed to say that, but I think there's a live translation pending final technical issues tomorrow. And we know that it goes out through WeChat and through Twitter. So it's not just Facebook, it's not just that avenue. So we're looking to expand that and also hopefully not too far away into Assyrian as well. And we'll continue to evaluate that service. We'll continue to look at every option that we possibly can in the time that we've got. But we've tried to really pivot quickly to each of those. And so really exciting to be able to do those. And absolutely, we recognise the importance of that too.
Thank you, Minister Ward. The Greek Herald, Dr. Jan, says there are some groups of people, more importantly, essential service workers who have priority access for currently or are currently eligible for vaccination. What about their families, the people in their immediate environment?
So some workers have had their families invited to come forward and be immunised because they're at high risk. So that was at our border workers, for example, and our healthcare workers' families, because they're actually being exposed to COVID all the time. Everyone else who's over the age of 18 is now able to get the AstraZeneca vaccine, and there are clinics happening, including our walk-up clinic at Prairie Wood, where there's no appointment necessary. So people who'd like to protect their families, the AstraZeneca vaccine is available now. It's not about waiting for several months. And, you know, my family, where we've got healthcare workers in my household, had my family not already taken up the offer, we would be lining up at an AstraZeneca clinic tomorrow.
Yes, thank you very much, Dr. Jan, for that answer. We also have a question now here from Multicultural New South Wales. It says, how can Multicultural New South Wales help us build spirits, as people are not only worried, potentially unemployed, stressed, and the next 4 weeks would definitely have an impact on people's mental health. Sophia asks, how can we develop a "we are all in this together" type of campaign? What's your answer to that, Minister Ward, and how can we build the spirits of everyone else?
Absolutely. It's really key, and we recognise that. We've put, just as an aside, on the health side, we've put further funding and programs behind mental health in particular, recognising that that has the need to be supported, and absolutely is by this government. From my perspective, it's key that we come together as a community through this. We need to all help each other and walk this journey together and pick up anybody that is falling along the way. I encourage everyone to talk to your family, talk to your friends, stay connected, not physically, but through these amazing social media channels that we now have in our lives. Pick up the phone, just check on people and check in and make sure that we're doing that regularly. And I know it's not perfect, but if we love our loved ones, we stay away from them physically, but we check in with them through all the other mechanisms that we have. We know that it's a challenge, and I would love to see a lot more, and I'm being very vocal about making sure that we have a lot more programs in place to talk about community and talk about and recognise the wonderful work that everybody is doing. We know most people are doing the right thing. We know that most people are supporting each other, and the best way to do that is through our community leaders, through multicultural media, such as yourself. So in particular, we know that specifically to address the social isolation issue, we're really trying to focus on making sure that we're reaching out to people and their community groups are surrounding them by the best means that we can, while keeping the health orders front of mind.
Thank you, Minister Ward. Dr. Jan, talk to us about what the special health accommodation and the community health accommodation. I think there's that opportunity for people to access that.
Look, it's a really fantastic initiative. We know that for a lot of people, the ability to isolate at home is not ideal. Many people are living with many people in their household. Now, we know with Delta that it's very easy to infect each other. And so the special health accommodation has been established for people who either have COVID or who have been in close contact with someone with COVID, to try and, if you like, move them away from their family, but into a home-like environment. The special health accommodation tends to be in serviced apartment type accommodation, so the sort of apartment that you might go to on holidays. But you've got medical staff available to you. So if you've got other health conditions, so, for example, people who may be heavily pregnant, most people would prefer to be at home, but people even more would like to know that there's not going to be any delays with bub if they've got COVID, for example. So by moving to the special health accommodation with your partner, you're in a place where you're supported, where you can have all those checks done easily, where the people are trained to look after you. And so that special health accommodation is not a basketball court with beds set up like we might see in the news overseas. It's actually service department accommodation where there's a lot of virtual monitoring by healthcare staff, but whenever you need a person in the room, there's a person in the room available to you. So really worthwhile if somebody has got COVID or has been identified as a close contact of COVID, thinking of taking up on that offer.
Thank you very much, Dr. Jan. Also, I just wanted to ask as well about contact tracing. When you said contact tracing and isolation, I think there's some miscommunication about what happens when they get a text, and I think steps to contact tracing, I guess.
Yeah, so when we know that somebody is a case of COVID-19, our public health team takes a very careful history from them to try and work out exactly who they might have given COVID to, as well as where they might have caught it from. That's called contact tracing, finding out who's been in contact with that person. And so usually if it's a person that you know and is in the same household, the person with COVID will possibly tell you. But for other people who've, say, been in the same workplace or been in the same supermarket, the first message you'll get is a message from New South Wales Health, which tells you that you have been in close contact and you now need to isolate. Isolate's different from the stay-at-home orders. Stay-at-home means you can still leave your home to shop or to go to work if you're an authorised worker. Whereas isolation means you actually have to cut yourself off from everyone. And that includes your family who's in the same household as you. So you're basically hanging in a room, you're not going to work, you're not going to the shops. And so you're looking to the people around you to support you. Now, if that's not possible because you live by yourself, then that's where moving to that special health accommodation can help, or we can help drop things to you to keep you safe in that time of isolation. But it really is very important that you don't go out into the community once you've been identified as a close contact or a case, because the capacity for you to give COVID to other people, no matter how careful you are, is still there.
Thank you, Dr. Jan. Look, it's 4:30, but maybe we'll squeeze in another question from Pawan Lutra from Indian Link. From Minister Ward, while a singles bubble has been introduced, any thoughts of an elderly parent bubble, meaning allowing one grown-up child to visit a parent, especially if both parents and children are vaccinated? So I guess for Minister Ward and Dr. Jan.
Yeah, thank you very much. We've recognised with the single visitation bubbles, it's really important that we try and get that balance right, and that's exactly what we're trying to do. We're doing as much as we can by keeping the health orders at the front of mind, but recognising that elderly people, our seniors, are amongst our most vulnerable. I have an elderly mum and an elderly mother-in-law, and I'm also Minister for Seniors, so I absolutely know that is critical. And so pending the health advice, we will do as much as we can in that space, and very open to ideas. So thank you for that.
Yeah, and I think it's important to understand that even under the current restrictions, we would have advised that one person only provide that care for that elderly person, and sometimes that elderly person will actually need you to enter that door. If our strong preference is that no one enters anyone else's household, but say it is an older person who really does need somebody to check on them, having a single person as that designated person is so important, rather than having one person check in the morning, a different person check in the afternoon, somebody else tomorrow morning and somebody else. And I know for a lot of us, that's actually how we do elder care in a community. We actually have a rotation of different people checking. And it's really important, though, that there's only one person who actually crosses the door. So even if 3 out of the 4 visits are dropping things off, they can't go through the door. And we're also asking our older people in our community. I've heard, you know, from different people who are older saying, I don't care if I get COVID, I just want to be with my family. But unfortunately, your family may also have problems if they get COVID from you. So please, if we can ask the older people in our community to really try and protect the young people who would give themselves up to look for them, and just ask them to stay away or drop things at the door and have a conversation at a distance.
Thank you, Dr. Jan. Minister Ward, any last words?
Yeah, I just want to thank you again for the opportunity to get together. It's absolutely critical so that we hear from you and that we hear directly questions and concerns raised by you. I just want to thank you particularly for the great work you're all doing, partnering with us in this journey. And again, it's absolutely critical that we keep those health messages going out to you. So please apply for those grants. Please make sure that you're accessing those and that you're getting the messages out to all of our communities, which has been done so beautifully so far. I just also want to personally apologise. I'm having terrible technical issues at my end, which I'm sure everybody has experienced from time to time. So I just want to thank you for bearing with me on those. And I also just want to say very much thank you to Dr. Jan, who every day is out there telling the health messages and you know, her priority is to keep us all safe. And I just am so very grateful for the great work that she and all the health workers do, because they really are our front line in all of this. So I'm very grateful for their help. And I know I was contacted by one in one of the contract tracing calls after being at Parliament, and they were very, very friendly. So don't be afraid at all by being contacted by them. They're absolutely lovely to deal with. Thank you very much.
Thank you, Minister Ward, and also for the contact tracing, steps for contact tracing. They're available on the New South Wales Health website in many languages. So in multiple languages, you can actually share that with your communities. Dr. Jan, any last words?
Just thank you, everyone. I know it's hard. I know it's really hard to see the light at the end of the tunnel, but the amount of work the community has put in to keeping each other safe is making a huge difference to where this could be. And so we just need to keep on keeping on and get more people vaccinated. And please, just if somebody's unwell, do get them to go and get that test.
Thank you, Dr. Jan. Thank you, Minister Ward. And thank you, everyone. We have received a lot of requests for those for the videos and recordings of these multicultural media online forums recorded. So we have them online, and I think that's been shared to you on your chat. So we'll share that with you. Thank you very much again, Minister Ward and Dr. Jan, and to you all. Please stay safe, and we'll see you again next week.